today. So thank you so much for being here during Nurses Week. Yay!
Yay.
So
Thank you for having me.
yes, we were talking before the call, and I would love to have you just speak on it maybe a little bit, that one of your nurses at your long-term facility actually came with a positive COVID.
I'm incredibly grateful for the work of all of our nurses and care providers for the last year and a bit. And it was inevitable, and we sort of knew that this day would come. And so we're really trying to not overreact. It's one person, and we're very fortunate that all of our residents have been vaccinated.
Oh, good.
And so we're hoping that if people do get sick, which nobody has yet, that we won't have loss of life, which is what has been in the media so much in Canada and the US in the long-term care sector specifically since COVID started a year ago. So fingers crossed, we're just, as we have been for the last year, we're just taking baby steps and one moment at a time and see where that leads us.
Then season 2, I realized we are all experiencing some kind of post-traumatic stress right now in one way or another. Here we're going to talk about post-traumatic stress, complex PTSD, all kinds of abuse, abandonment, relationships, and suicide. We're going to have real-life examples as well as take-home tips to help you get started your healing and recovery today. I've got an amazing lineup of fantastic guests and specialists. Let's get started right now.
Welcome to Multiform PTSD. Here's your host, Tracy Lowry.
As Michele is working in a leadership role, overseeing 2 long-term care facilities, she's always had a short staffing issue. But now with the worldwide health crisis, there has been an increase in staffing issues. Today we'll talk a little bit about many of those issues that were brought on and intensified by the COVID-19 pandemic for nurses and other frontline workers. Her appreciation and love for her nursing staff is one that I had to share in order to better support our nurses during Nurses Week. How did she handle the news of their first positive case in their facilities over a year later? What does she stress to her staff about self-care? What message does she have for nurses and other frontline workers all over the world, especially during Nurses Week? Find out in this episode. Please help me welcome Miss Michele Thomson. Okay, thank you for being here, Miss Michele. How are you?
I'm wonderful. It's sunny in Vancouver, so thank you for having me.
Nice.
Yeah, it's getting up to, I think, 16 degrees, so it is official shorts weather here in Vancouver.
Isn't that funny? I grew up in northern Michigan, but I also lived in Texas. So definition of shorts weather, very different.
Yes. Well, I have a beautiful view of the ocean, so I can't complain too much.
Oh, wow. That would be awesome. The water is my happy place. It really is.
I'm very fortunate. Sometimes there's the occasional whale that actually comes right into the bay that we can see. So, yeah.
That would be heaven. That would be heaven. And where is it you work?
So I am located in Vancouver, and my office is downtown Vancouver. Okay. And I primarily work right now in the long-term care sector with seniors. Okay. But I have worked in a variety of healthcare settings throughout my nursing career. So those include long-term care, but also intensive care, general med surge, home care. I've kind of done it all.
Awesome. That's the beauty of nursing. For those of you who think that nursing is just kind of looks one way, there are so many different specialties and ways you can go with it. And I would say thank goodness, because I was a cardiovascular telemetry nurse. And there were people who were like, nope, would never want to do that. And I would say, well, good, because I like it here. I don't want all the competition, but I look at like OB nurses and I go, nope, can't do it. So there's so many different areas that you can do in nursing. And I find a lot of nurses kind of dabble throughout their long-term career. They kind of do a few different things. So I love that we have all of your different directions and points of view to talk about today. So thank you so much for being here during Nurses Week. Yay! Thank you so much. So
Thank you for having me.
yes, we were talking before the call, and I would love to have you just speak on it maybe a little bit, that one of your nurses at your long-term facility, correct me if I'm wrong, actually came with a positive COVID.
Yeah, so I found out late last evening that one of our nurses who had been off for several days came back to work and partially way through her shift was not feeling well, finished her shift. We told her to go for a COVID test and found out that she, in fact, is positive. So we have been, I don't know if fortunate is the right word. Lucky, I think there's definitely some luck in that, but we've, definitely also done all of the right things
Mhm.
to have COVID not enter the two long-term care homes that I oversee.
Mhm.
And I'm incredibly grateful for the work of all of our nurses and care providers for the last year and a bit in being a huge reason for that. But I never like to say but I'm saying but in that you kind of it was inevitable, and we sort of knew that this day would come, and so we're really trying to not overreact. It's
Mhm.
one person, and we're very fortunate that all of our residents have been vaccinated.
Oh, good.
And so we're hoping that if people do get sick, which nobody has yet, that
Mhm.
we won't have loss of life, but that we'll be dealing with illness rather than a situation of death, which is what has been in the media so much in
Mhm.
Canada and the US in the long-term care sector specifically since COVID started a year ago. So fingers
Yes.
crossed, we're just, as we have been for the last year, we're just taking baby steps and
Mhm.
one moment at a time and see where that leads us.
Absolutely. Well, I certainly, on behalf of everyone here and listeners, I wish nothing but the best of a quick recovery, a full recovery of that nurse. And, bless her heart. I'm sure she's dying 1,000 deaths emotionally in her head and all of those things and not feeling well. I had COVID uh, end of the year, beginning of the year
Mm,
time, and it was not fun. So my heart goes out to her. And hopefully, since everyone is vaccinated and you guys have done such a fabulous job keeping it out thus far, hopefully it'll just be a little bump in the road, and hopefully everyone will end up doing okay, and as well as
yeah.
can be in the possibilities of the realm of what's going on today.
Yeah, thank you. I hope so too. I mean, honestly, our focus mostly today has been on supporting her because I think that that's one of the things that our nurses have been dealing with for the last year is the fear of quote unquote being the one to bring it
Right.
in or make others sick, and the fear and the guilt of that, and unfortunately for this nurse that has come to fruition for her, and so we're really trying to support her and hold her privacy and make sure that she knows that nobody's blaming her for what has happened, that it certainly wasn't intentional,
Right.
and that we're going to make sure that her privacy is respected to the best of our ability. And through contact
Yes.
tracing, her name will be not disclosed, but I think that's been a real worry for nurses in any sector, is that people will find out it was them that infected their workplace, and that somehow there'll
Right.
be some judgment or being ostracized or looked at
Right.
differently. And so we're really just trying to hold that space for her right now.
Well, bless your heart. Bless your heart.
Thank
Speaking as a
you.
nurse who have um, worked under some really amazing management, and also worked for facilities that did not have very great supportive management. Um, Bless your heart for being there and thinking about how this has affected her and is affecting her. And I'm sure it wasn't on purpose. It's every nurse's
No,
worst nightmare to be the
absolutely.
reason that anything like that comes into the building.
Yeah,
So
absolutely.
thank you. So while we're talking about that here on Nurses Week, I
Mhm.
would love for you to speak on what are you seeing with the nurses and the medical staff on this side of things, and the traumas, and what has kind of changed in the medical field on the medical personnel side of things. What are they dealing with?
Gosh, lots of change. In so many ways, it feels like COVID just started, and in so many ways, it just feels like we've been running a marathon that's never going to end. And
I'm sure.
I would say in the early days, we were really all running on fear. pure fear. It was that pure
Right.
fight or flight response where we didn't know what we were facing. And,
Right.
myself included, I've nursed through SARS and H1N1 and kind of thought, oh, it's a super flu, wash your hands, keep your hands off your face, we'll be fine. And really kind of thought we had the capacity as a, as a planet, as a whole, much more larger perspective to be able to deal with this, and never for once in a moment thought we would be facing a global pandemic. And I think that a lot of nurses felt that way, and so they've kind of felt assured, like we'll get through this. And it
Right.
wasn't until I think towards the end of March, specifically in Canada, where we were told you need to come home if you're not home, and we're locking down the borders, when everybody had that kind of holy, like, we're in this now. And
Right.
really I saw the fear kick in. Our team started to kind of fall apart a little bit. I had to travel to go be with them because they were really just struggling with, what do we do? And nobody knew. I mean, CDC
Right.
and our bodies here in Canada that support safe workplaces were really all just struggling. Everybody was just trying to come up with the answers. Right. So we were
Yeah.
just all doing our best. And
Yeah.
unfortunately, I don't think it provided a lot of assurance for frontline workers, specifically nurses. So I think we transitioned from that to us being able to create a space where we had our employees feel like, okay, we're following all the rules, we're following all the regulations, and we've stepped it up a notch. So we started offering things like laundry service so that they could leave their uniforms at work and not have to take them home. The next day they would come back, they'd be laundered and ready for them to be picked up. And free food at work, as much as we would be able to provide that. Unfortunately, there was already a staffing shortage pre-COVID, and this just
Right.
exacerbated that. So the workload and the amount of hours that not just our employees, but I would say in general, have been asked to work, have been incredible. And again, I will be forever indebted and grateful to the service of all nurses, not just in long-term care, but I think we just have this intrinsic, we don't walk away from things when they get tough. We kind of like dig our heels in and we're like, bring it on. Like that's just part of who we are, and what makes us so committed to the work that we do. And we certainly saw that for many, many months, where our staff were almost in this hyper state of, we're fine, like we're go, 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 and everything was okay. And it's really just been, I'd say, in the last 2 months where we're really starting to see that kind of quote unquote burnout. And some of those symptoms that we would normally attribute to that, which is, more fatigue, people are more irritable, uh, we really need to hold space for them for a lot longer. There's a lot more emotions that have come to the surface, frustration over kind of the changing rules and regulations that never, we just seem to pivot and make a change, and then just a few days later we're having to change again. So I feel like that constant state of change has really impacted people's ability to stay in a state of resiliency, and has now really pushed a lot of people into potentially that post-traumatic stress, where this is not going to be something that is just going to be over when it's over. We're going to have to support them through this in the long term.
I agree. And it's a term that I don't think is widely talked about enough. But when we talk about PTSD, a lot of times we talk here, it's not just for those who are in war and soldiers. But it sounds to me like, and I've been out of the nursing world for a couple of years now, you're never out of it, but I haven't been practicing for a couple of years due to my own health issues. It sounds to me like they're experiencing like a complex PTSD, where it's kind of the repetitive, it's not necessarily the one time event. It's a repetitive, chronic, but traumatic experience, which really can change if it's so prolonged, and it's been over a year now, where it really starts to affect you at your core. Like you said, we as nurses and in the medical field, we do feel that responsibility to kind of step up and be resilient, and we have to be the strong ones. And But in a traumatic experience in this pandemic that we're experiencing, you can only do that so long. When you don't have the reserve, it can only last so long. So now you're starting to see that kind of wearing down. And, you know, with the shortages, how are you dealing with, I can only imagine you've already had the shortage for staffing, especially in long-term care, which is kind of an issue, I think, all over
Mhm.
right now. And then the pandemic hit. And now normally when you have, correct me if I'm wrong, if you have someone who's experiencing that burnout, that overwhelm, a lot of times what you do is, you give them a break, or, have them take a week off or things like that. And now you're already short. So how, that has to be such a hard balance to balance the health of that individual and your team and your frontline people, and also making sure that you're well enough staffed to take care of your residents there in your building. Can you
Mhm.
talk about how you kind of try and balance that?
Yeah, it's a great question, and I wish that I had a great response for you, and I don't. And I don't know how we've really been doing it for the past year, to be completely honest, other than
That's
just to
fair.
say we have. And then again, I mean, it's really just been to the commitment of our nurses to stick in there and just continuing to show up at work. I mean, certainly we have had a lot of conversations where we've tried to include them in as much decision making as possible and to provide as much autonomy as
Right.
possible, which I think certainly helps people to feel that, at a time when they feel, I think that a lot of what is happening to them and around them is out of their control,
Right.
that we're trying to instill as much control where we're able to as possible. And so we've tried to do that. And the the appreciation and the employee engagement are always things that employers try to do. And if I hear about one more pizza party happening, I just like I it's just employees for years have told employers, stop with the quarterly pizza parties. Like, they're just, it's almost insulting. That's not what we want, and that's not what we need. And so we've
Mhm.
really gone to them and said, we want to acknowledge the work that you've done. So what can we do to help with that?
Right.
And some nurses have said, at Christmas time, they wanted gift certificates so that they could buy a turkey for their family and groceries, rather than us, buying food for them or trying to have some sort of pseudo party. So we've
Mhm.
really gone to them to try to say, what is high value for you in terms of us being able to support you through this, and how can we do that? And we have, as much as possible, been able to accommodate our employees where maybe they've got kids now that are at home, and before they were in daycare,
Right.
where it's difficult to, when you're on a 7 to 3, 3 to 11, 11 to 7, where you're basically waiting for the next shift to arrive to let your next staff, to have them go home. It's difficult
Yeah.
to have flexed hours, even though we would want to, and we support that.
Right.
So we've tried as much as possible to see what we can do to support some of those staff members who have had some childcare issues or family issues that have come up through this, that and their colleagues have been great about it, because I think that they know that if that comes up for them, we're going to also extend that. And so there really
Right.
hasn't been an abuse of that, or kind of the, well, she's getting something and I'm not getting something over here. There's really been a coming together to say, okay, like, if this is going to work in the long term, we got to pull together. And I
Yeah.
have to say that, again, collectively, there really has been this camaraderie and this coming together for the most part. Now, I mean, not everybody shows up perfectly every day, and myself included.
Right.
But I think that that's part of the process, is like also acknowledging that we're all at a point right now where we're not always showing up in the best way, and we need
Right.
to not only give ourselves some grace, but hold that grace for other people to say, I'm going to give you this one today because it's okay. We might need to have a conversation about it, but
Right.
I'm gonna give you a get out of jail free card on this one today. So there's
Right.
there's there's been a lot of those conversations as well.
Well, and bless those nurses, obviously, for taking that team ownership, and almost sounds like family connective mentality, but that says a lot for management too, that works the way it does. Like I said, I've worked under both managements, and management really does create and set that tone and that space. So well done. Um,
Thank you.
yes, I applaud you. And like I said earlier, as an RN, we thank you all over the board for being the good kind of management. So, are there things that you're trying to work with your nurses? What kind of support and help are you giving them to try and keep their, because mindset is huge,
Mm.
and filling their own cup right now has got to be huge. Are there any resources or things that you've noticed are helping that maybe you can help the listeners maybe figure out something that they could start doing?
Yeah, so I have been providing a lot of information on self-care
Mm.
and kind of what is self-care, and how do you go about providing self-care, and I think that for a lot of our nurses, that's been really helpful in understanding that self-care isn't just about going for a pedicure and more of those self-indulgent things. It's really about at the core kind of sitting with yourself and
Mm-hmm.
just being quiet and turning everything else off and allowing whatever comes up to come up. And sometimes those are the ugly tears, and they need to come out. I truly
Yes.
believe that crying and tears helps you work through whatever is there, and that can often be a barrier and a roadblock, and letting that out can be very cathartic for a lot of people. So
I
we've
100%
been
agree.
we've really been trying to at work create a space where if people are really showing up and for whatever reason they've been triggered by something, that they can have that safe space. If they need to fall apart and have the ugly cry, they can do that with whoever they feel safe to do that with, whether it's part of our leadership team or not.
Right.
And that there's not going to be judgment for that, to encourage them to do as much self-care. So things like, just getting out and going for a walk on their breaks, or in between shifts, trying to eat well and stay hydrated. But then I think as much as possible is to stay connected with people in their inner circle as much as possible. I
Mm.
think in the early months, a lot of our staff were so afraid of bringing COVID home that some of them actually either kind of hunkered down in a spot of the house where, maybe the rest of their household members weren't living,
Right.
and really being careful, and started to really isolate themselves from
Right.
having the connections that are so meaningful at a time when we're really struggling with mental health, and we rely on just even human touch,
Yes.
the power of a hug, or to know that someone's in your corner and they've got your back. I think
Yes.
that for a lot of people that had been lacking and missing, and so we're really trying to encourage them to engage following all of the rules that we have, but
Right.
to do that in a safe way, and keep those relationships kind of going. And then, if it feels right for them, to encourage people to journal or to get those emotions out. But really, I think it's about just allowing them to know that sometimes it's good just to sit with those emotions and really figure out, like, why is this coming up for me? And what does
Mm-hmm.
it mean? And if I'm feeling sad, what does that even feel like? Like, where is that? Where am I feeling that sadness?
Yeah.
And where in my body am I feeling it? What does it look like? What does it feel like? So that when it comes up again, people are able to really identify, oh, I remember this feeling, this is what it felt like. And it's starting
Right.
to develop some of those self tools to be able
Self-awareness.
to kind of work through that, so that, again, we're not necessarily building resilience, because I think people's reserves are tapped out, but we're really leveraging the ability of the body to nurture itself when needed. And if you have the
Mm.
ability to have that level of awareness, that you can really help yourself in those really difficult times, if you've allowed yourself to just kind of get into the ugly parts, and sit in that, and know that whatever comes up needs to come up, and it's okay, and let it go. And then you're, often more likely able to move on in a better way.
I love that you're speaking on that. I stress that because I feel like a lot of, the self-help industry, with all best intentions, focus so much on the just, thinking positive and finding ways to be happy. And I can get on board with that, but you have to have that space because we are human. And whether it's emotional pain or physical pain, they are showing us that there's something wrong and it needs attention, it needs help, it needs healing. So I love that you spoke on sitting there with your ugly tears and really dissecting, why are you feeling this way? How is it feeling? Where is it in your body? Where is it settling? And really working through that and journaling, not just pretending it doesn't exist, because that's just going to stuff it even down further and it's going to come up. It's going to come.
Absolutely.
So if you can do it in a controlled manner, and in that safe place, whether it be a safe place at work or when they go home, whatever it is, I think that is so huge that you are not giving them permission. But sometimes I feel like we need that permission to not be okay and to be sad. That is human. That just means we need to work through something. So I then say, don't unpack and stay there. Don't stay in that misery and that anger and that sadness. But if you work through it, then you can work through it and get on the other side. So I love that that is a part of what you teach.
Thank you. Well, one of the things that I learned through this process is a new term that I had never heard before called emotional labor, where it's defined as when you take on the emotions of a collective of others, which we often obviously do in nursing, and how taxing that can be to your nervous system when you're constantly absorbing all of you think it's your responsibility to take on the safety and security of all of these other people. And over time, how difficult that is to be able to then get out of that space to think it's not actually my job to hold that for everybody. And I think as nurses, we take that on. We take on so much of that. And, particularly when nurses I think of in ICU and in acute care sector that have been asked to make decisions that are contradictory to their ethical, their ethical standards, and really end up having a lot of moral distress in that, where because of maybe lack of PPE or resources, people they're really being they're being asked to make a decision one way or the other, and in their practice that's not something they ever thought they would do. And so again, then they start absorbing more and more and more of that. So we really talk to our nurses about really trying to understand what happens in the brain when there's been trauma or a consistent fight or flight response that's been happening. Because a lot of them have said to me, well, I never had anxiety before, and I don't understand why I can't just get over this. And what I try to explain to them is that when your brain's been traumatized, it actually changes the way that your brain functions after that. And so you don't always have the same ability to feel safe. Your fear responses are hyper stimulated, and your prefrontal cortex, where kind of all of those core thoughts are happening, isn't always able to rationalize some of those thoughts that you were able to have before. And so it's really normal to experience these scattered thoughts and feeling like why can't I just get over it? Well, it's really normal. It's because your brain has gone through a trauma. And so when they realize that that's normal and it's not just them, you can see a lot of people are like, oh, okay. And I think it's helpful just to know you're not in this alone, and that this is normal, and your brain is actually responding in the way that it's supposed to when it's been faced with that fight or flight response for an extended period of time. So I like to think that that's been, helpful conversations we've had.
Absolutely. And you really touched on something. When I'd never had anxiety before, and then all of a sudden had, my own traumas. It was before the pandemic, where I just had my complete and utter meltdown. And I remember thinking the same thing. Like, I don't understand. I used to be able to just force my way through it or fight my way through it or just bear my way. I never had this issue before. Why can't I do this now? There's such a relief when someone says to you, kind of gives you that validation of, there's a reason for it and it's normal. That in and of itself was when I started my healing. When someone looked at me and said, well, of course, you've been through this and this and this and this. Of course, your body is having an adjustment period, and it's not going to function the same because it goes into safety mode. It goes into fight or flight or freeze or fawn, and it just reacts. And just like when we get cut, our body has a reaction and it bleeds, and it takes a certain amount of time for it to heal.
Yeah.
Same thing with emotional pain and trauma. Our bodies have a reaction to it, and it's not something we can help. We can't just look at a cut and say, okay, now stop bleeding now, because I need to fight through it. It's going to bleed until it's done bleeding.
Yeah.
So
And
that's
I think
important.
that's a really good point, because what some of our nurses I think have been struggling with is the shame of if they reach that point, because they, again, I think that we're always in this world of comparison, or imposter syndrome, where we're always comparing ourselves against the measure of somebody else. And I've had experiences in my life that have allowed me to build up resiliency and tools that I can pull out of my toolbox that other people don't have. And so it's not fair then to say that, well, because I haven't yet, needed to reach out and ask for professional help, or to do certain things, that I'm not doing things in the background that I maybe don't share with people. But some people I know, some of our nurses have said, well, I don't want to be the first one to say that I can't cope, or that I'm feel like I'm breaking down, because I need to be strong like my colleagues. If I call in sick, then I'm letting everybody else down. And again, I think that's really just a conversation we really had to have with a lot of nurses, to say, this isn't a competition. Like there's no winner here or loser. This is a personal experience. And whether you tap out today or tomorrow or never, the reality of it is that it's impacting everybody in very specific personal ways. And I learned this very, very well when I worked with First Nations groups here in British Columbia a few years ago, when we went through our wildfire season. And we had nurses in very remote northern communities where those communities, unfortunately, were completely wiped out because of the wildfires. And we didn't have loss of life, but entire communities were left homeless because of the wildfires. And they seemed to just, kind of plow through, as you suggested earlier. And every time we asked them, are you guys okay? And no, we're good. And again, in the moment, I should have kind of known. And it wasn't until the following summer that we had wildfires that were starting very early in the season, and the sky kind of turned this orangey hue. And within 48 hours, we had half of one of our teams that were completely triggered by that, and just were completely in avoidance. They couldn't get up, they couldn't go to work. And it was just that, and none of them were expecting to be triggered, because they felt like they were doing fine. Like, I'm okay, I have no issues. And so, that's one thing I always say to people, is that you might be feeling okay, but you might not be feeling okay 6 months or 7 months from now. And it's important to remember that that's also really normal. And to expect that those triggers might come up, and they might be things that like you never thought would be a trigger. And to be really aware of that and mindful of that, and to ask for help if you need it. So that was a huge learning for me, even as a nurse, not really being cognizant of the fact that those triggers could show up so late in the game and really take people down by their knees. Like legitimately, these were nurses who felt like they had it together and they were fine, and overnight were completely incapacitated and unable to work, and really didn't understand what was happening.
Absolutely. And I feel like making that connection really will help them as well, because I know there would be things that would come up and I would be triggered by, and I'd be like, that was like forever ago. I don't even think about that anymore. Why is that showing up years later? It's different for everybody. Everyone reacts differently. And for those who feel like they've, just kind of gone gung ho, I like to say probably part of what made me a decent nurse was, in the moment, I'm great in a crisis. When things are starting to circle the drain and I'm in there, I'm ready to go. But on my way home, I used to have an hour and a half drive home. I might cry the whole way home. I mean, afterwards, after I knew, it was over and I was safe and all of those things, afterwards, I fell apart. And that was okay. I had to let myself do that, or it would just build and build and build. But I think that's very common with nurses, to be that way, or we wouldn't be, doing what we do. But it's the afterwards, yeah, in the moment, during the tragedy, during the pandemic, whatever it is, during the fire, we're good, we're solid because we have a goal and we're ready to soldier on. But then we get reminded of that and it's like boosh. It's like I call it a bushwhack. You just feel like you've just been swept right off your feet and you're like, what the heck? I did fine during the trauma. Why am I upset now?
Yeah, and I certainly, thank you for that, because I had one of those moments about a month ago. I was, at home, and I don't know, I think I was just cleaning my house, and um, I'm one of those people that loves a clean house. Once it's clean, I actually get some sort of sick satisfaction out of cleaning my house. So I was actually doing that to de-stress a little bit. And I just all of a sudden had this wave of emotion and had to stop and really just let myself have that ugly cry. And my poor husband saw that I was upset and he's like, what? Like, I don't know what to do. What's happening?
Right.
And I said, I don't even know why
I
I'm
don't know.
crying. I just, and the poor man, he's just like, I don't know what to do for you. Please tell me, help me. And I said,
Right.
nothing. Honestly, I'm okay. I just needed to have a really good cry and let it out. And I really thought about that for the rest of the day. And I wondered why it kind of came up in that moment. And I think for me, it's just really been, I was asked the question around that same time, and they said, you must be thrilled to know when COVID is going to be gone. And I think for me, it was that sense of, well, it's never going away. I mean, it's here forever. We're going to be dealing with this now, as part of our new reality. Certainly, we're not going to be in the state we're in now forever, but this
Right.
is not going anywhere. And when I thought about that for a little bit, it really kind of just put me in this place of real sadness and thinking about that. But
Mhm.
also, I think the fact that I was also a little bit afraid of, quote unquote, it being over, because to your point, we've just been on autopilot and putting one foot in front of the other for so long that that's all I know. And I'm kind of afraid to let my guard down a little bit, because
Right.
you start to see the cracks, when that happens, and the
Yeah.
ugly cry that starts that never stops, right?
Yeah.
And how do you cope with that? And so I've started to do some of those things that I mentioned earlier, around really journaling on those days when I'm struggling, or really just sitting in that space of like, why am I feeling this right now? Like, why am I feeling so agitated about something that would normally not irritate me? Because
Right.
it's generally related to what we're going through, or the fear that I have of, being in a leadership role where I have 300 people that I have to keep safe every day. And if somebody
Right.
gets sick, is somehow a reflection of the fact that I didn't do my job well enough, when in fact that really has nothing to do with it. So it's kind of
Right.
taking the ego out of it as well, and
Mhm.
recognizing that we're all in this together. We're in the same ocean. The boat just looks a little different. So,
Right.
how can we support each other? So, thank you for mentioning that.
Yeah. No, thank you. Thank you for that beautiful perspective, because you're right. We're all in the same boat, and literally, I mean, and the whole globe is dealing with this right now. A lot
Mhm.
of times it's just the United States, or just, here in the, North America. It's worldwide now. So we really are battling it all together. And I think a lot of how we handle things like this now, will be a lot based on the past traumas that we've had,
Mhm.
and what it might be triggering in us that's completely not even related.
Mhm.
I know a lot of mental health right now is an issue for different people, and there's more abuse now going on,
Mhm.
and the kids are at home more and the parents are at home more, and so it's causing more volatility in those situations, which is obviously horrible on our mental health. And I think isolation for long periods of time or even limited contact with other humans, I think that is huge on our mental health. And so not only are we worried about the pandemic, but we aren't even able to cope the same ways that maybe we used to be. There's those of us who are extroverts, who that's how we used to cope with things, and now we can't really be extroverts anymore because there isn't anywhere to go be, and you can't be in large amounts of people and crowds, and a lot of that has changed.
You know, one of the things that I talk about in the self-care that I do is around mindfulness and and really I think to the point of, you know, when I worked in ICU years ago, I remember I could, you know, work several 12-hour shifts in a row where I could go home and not tell you the color of my patient's eyes. Like I had no idea. You're so busy doing the tasks and all the things. And yes, some of them are awake and some are not, but I couldn't tell you some of those personal pieces. And you know, I say to our nurses now more than ever, because we're all wearing masks and so much of our facial expression and our ability to share that I understand you and I hear you with the nodding, and that eye contact is so much important now that, you know, I say to them, when you go out, if you do go out in public, make a point to make eye contact with the person you're talking to. Really look at the color of their eyes. Be mindful to say, what color is that person's eyes? So you're really looking, and it doesn't have to be weird.
Right.
Just be, you know, like you're not being kind of creepy, I'm staring into your eyes, but just
Right.
really being mindful of making that contact in that way that's really personal. Because I think it's so much more important now than ever to have people feel that somebody's really seeing them and hearing them, and not just that it's been this quick exchange, but that that person's really been validated as being seen and heard, and that someone else is kind of taking the essence of that conversation away and trying to make those connections where you can. Because I think that we all need that so much right now. And I think of, you know, little children who are, you know, 3 and 4, who have now spent a year and a half of their life not knowing anything other than everybody wearing a mask and not being able to see the bottom half of people's faces. And I think socially, where are those kids going to be in 5 or 6 years from now? And are we going to be dealing with some societal challenges, with some social stunting in for lack of a better term, in terms of really helping people understand around human connection and touch and all of those things that I think we've just taken for granted and are so important to our mental health.
Absolutely.
Yeah.
Absolutely. And what a balance it has to be when you're working in a place where you are so, you need to be on your game, and you need to be able to be there and present with the people you work with and your patients and your residents. You want to be there, and you don't want to make them sick, and you don't want to make things worse, but you also do need that personal touch, like you said, and communication with your close family. And what a push and pull that has to be for those in the medical field. So thank you for going through all that. I mean, every year Nurses Week that comes around, you know, you always feel good and people notice you for a week, and it's great. You know, people tend to sing your praises, and that's great. But now I think we need to be praising our medical personnel, especially our nurses and our techs or CNAs, whatever you call them over there. I don't know, but the assistants that help us do our job right there on the front line. It's really a frontline battle that they're battling right now, and they are, you know, we're dealing with the surrounding side of all of this, but they are dealing with that as well as seeing it face to face every day.
Yeah.
And
yeah,
that
absolutely. We couldn't do it without each other. So, you know, we have always, in our buildings, when Nurses Week has come up, it's always been everybody is acknowledged. I mean, certainly we don't do that to take away from our nurses in any way, but we also don't want any of our aides to feel as though the contributions that they make are less than. Because they don't have an association or a week on the calendar that acknowledges the work that they do. So what we always try to have that be, you know, without the group effort, we wouldn't be able to accomplish what we can do. And so that's really always a team effort and a group thanks. And that seems to have really landed well. I think most nurses know that it's not a me thing, it's a we thing. So they've been really happy to share that week with their colleagues. Yeah.
So, what would you say to the listeners now who are really struggling with this pandemic and their mental health and all of those things?
Yeah.
What would you say to them? How can they change things today, right now, to at least get the ball rolling in a better situation? And how would you support them at that?
Well, I would say personally, some of the things that we've already talked about, know that you're not alone. So just acknowledge that you're really not alone. And I think that sometimes when we are in those places, those really dark places where we feel it couldn't get any worse, that's when we feel the most alone and can be the most difficult to ask for help. So, let go of the shame or whatever it is that you're feeling, and that sense of like, I should just get over this, and just give yourself the grace to know you're only human,
Right.
and you have done the best that you can up until that point, and that if you need help, this is not a sign of weakness or anything that you need to be ashamed about. It's really just your body letting you know that it needs some help to work through whatever it is that's going on inside, and that there is no shame in asking for help. So I mean, I think that's the first thing I would say. And in the workplace, I would hope that most employers would be open to creating a workplace where employees can come forward and acknowledge when they're maybe not feeling supported or safe, or they're questioning, maybe some practices that are happening in the workplace around specifically maybe COVID, around policies or procedures, and that there can be an open dialogue and some transparency, and that everyone feels that they're part of the bigger picture. Again, I think that when people feel that they are asked to engage and that they have an opinion that is being acknowledged and heard and valued, that really helps to settle those feelings of maybe feeling really unsafe or fearful coming to work, that they can be part of the decision making that will influence their work environment. I think can be really helpful to people. And again, the last one I would say again is just be prepared for triggers. And I know we've talked about that, but that was a big one for me. And that's something I'm also keeping top of mind for myself, is just to be aware that those triggers might come in a week or 6 weeks or 6 months or a year from now, and to know that if they come, that's okay, and we'll deal with them. And but I think that we need to keep the conversation going, particularly in the workplace, where once we're kind of out of this scary place that we're still in, and the third or fourth wave or whatever number we're in at this point, that we keep that conversation going as we have with psychological health and safety in the workplace, and that's kind of become the buzzwords, and we write all of those things into our policies and procedures. But I think we really forget about that human piece, that connection that people need and desire to feel valued at work, and also just safe to come to work, is to keep those conversations really continuing, so that if people are triggered, that or even just in through influenza season, when it comes up in November again next year, that's not a conversation you just bring up because it's that time of year. It's a conversation that continues, stays alive, and it really becomes embedded in how you work, the work you do, and your overall shared value and workplace culture that you create, so that people continue to feel safe to say, I'm actually not doing so great today. Like I always say to staff, when I ask you how are you doing, like, I'm not looking for lip service, I'm legitimately asking you how you're doing. So if you're not having a great day, then tell me that, because I need to know. And I think it's really just having those super frank conversations at work to say, when you're not having a great day, it's okay to be like, I'm actually not having a great day, and finding someone who can help you with maybe what you need on that day. And maybe it's just like I said, to hold space, or to cry, or to be able to just have people know that today's a day that you're feeling a little more fragile and you need a little bit of a break. So yeah, I could go on and on and on, but I think that those would be the three that I would hope that people would take away, and just know that they're not alone in this.
Well said.
Thank
Well
you.
said.
Yeah.
Well, thank you so much, Michelle, for coming and participating and bringing such a great viewpoint that I don't think we're hearing enough about. And thank you for doing such a great tribute to the nurses and our staff and our helpers and all of those things. And I'm so glad that you're so aware of the triggers and that people are going to have bad days, and there's, sometimes you have to kind of give someone, okay, I'm going to give you that because you're having a tough day, and maybe not being so quick to jump and be offended and things like that. We're all, doing the best we can, and yeah, there may be conversations that need to be had, but we're all just doing the best we can right now. So
Absolutely. Yeah. And I, I think a lot of nurses have felt that at the beginning of COVID, they were, seen as these healthcare heroes, and everybody was doing the claps and the cheers. And when that stopped, there was, the sense of identity that had been lost, and lack of recognition. And as we've gone on in time, we've certainly found that that has become a little bit negative, where people are not cheering as much for nurses, and when they go at a hospital and they're frustrated with a process or having to wait, that the nurses are now really absorbing a lot of that too. So I just want to say to our nurses that I am so proud of all of you everywhere, and the work that you do is phenomenal. You are a hero. You will always be heroes. And I think that the world has acknowledged finally uh, the type of person it takes to be in the nursing profession and continue to nurse through something like this. And I am really, really proud of not the bad press that any of our nurses have got in any sector, but really the demonstration of when times get tough, we really are a community that just digs our heels in and gets in there and sees it right through to the end. And I believe that, if we need help, that people are going to be there to hold us up and support us. But I just want everybody to know that you're amazing, and the work that you do is amazing, and that if you feel like you're not being seen, please know that for wherever you are and wherever I am, I see you and I hear you, and I thank you so much, and you are so, so valued for everything you do.
well, I don't have anything to add to that. Thank you.
Well,
I'll just
thank
say
you.
amen and ditto. Absolutely.
Thank you so much for having me. This was such a nice way to kind of break up my afternoon after a bit
Oh,
of a
good.
crazy morning. So thank you so much.
Well, thank you for still coming, even though things were crazy, and bringing you your great spirit and your diligence and your praise and up talking our nurses. I truly, truly appreciate you and all you do, and would love to have you back anytime.
Thank you. I would love to come back. Thank
Yes,
you so
that would be
much.
awesome. Thank you so much.
Okay.
How can people find you? And
Yeah. So you can visit my website at
okay.
www.curasconsulting.ca. And all of my social media links are there, and Linktree and all the things. So
Mhm.
that's easy to find me. I also have, if people wanted a little infographic on um, it's Dr. Daniel Siegel's Flipping Your Lid.
Uh-huh.
It's the hand diagram of kind of what happens when there's kind of that fight or flight response. So if people want to
Nice.
use that, I also have an infographic. If they want to reach out to me or DM me and let me know that they heard me on your podcast, then I'm happy to send that to anybody, and they can use that either in their own personal practice or in their workplace. Yeah,
Awesome.
yeah.
Awesome. Thank you so much.
You're welcome. Thanks
Appreciate that.
again.
Yes, thank you so much for being
Happy
here,
Nurses
and
Week.
happy Nurses Week to you too. And thanks again for being here, and we appreciate you and all you're doing. I think a lot of times, and hopefully not necessarily in your case, but sometimes there can be a real disconnect between, I think, the nursing staff and the upfront staff, and sometimes the administration and the leadership. And I truly appreciate your willingness to kind of bridge that gap, it sounds like, and really meet them in the middle. I think that's
Yeah,
great.
thank you for saying that. I mean, we're not perfect and we don't always get it right, but I think that's a
Right.
big part of bridging that. To your point, is really just acknowledging when you mess it up and you don't get it right, is really just owning it. And
Right.
I tell people just because I'm in a leadership role doesn't mean I'm the leader. We're all leaders. And I'm not going to have all the answers all the time, and I don't want them all of the time. You're the experts more than I am in some areas. So we got to figure it out together. And it's really, I think, empowering people to lean into those leadership roles when they feel that maybe they're not, so that they can realize that they are. So thank you for acknowledging that. But yeah, I hope more workplaces are also on the same journey we are, because I do hear sadly from a lot of nurses that I work with or that I've coached is that they're leaving just because of really bad leadership and bad workplace dynamics and incivility in the workplace. And we really need to be holding each other up and coming together and figuring this out. So
I agree.
yeah, if I can do anything or for any support, I'm happy to do my part. So reach out.
Awesome. Well, on that, I'm going to thank you for being here,
Thank you.
and good luck with your nurse and all that goes behind the scenes along with that. I wish you all good luck and full quick recovery and healing for everyone involved, and no spread anywhere else.
So far, she's feeling great, and
Oh, good.
and no one else has had any symptoms yet. We're doing advanced screening, so far so good. Knock on wood.
Yes, we'll keep fingers
we'll be
crossed for
okay.
you.
Yeah, thank you so much. The
Yes.
universe has a way of showing up in weird ways, and again, I think that this was perfect timing. So thank you so much for this.
You're very welcome. Thank you so much for being here, and
Okay.
good luck to you.
Thank you.
Hey, it's Tracy. I'm just here real quick to remind you to please subscribe to this podcast wherever you're listening. We're on all major podcast platforms, including Google, Apple, and Spotify, and also on YouTube. So make sure you're subscribing. Every subscription helps us out. Thank you so much for listening. Make sure you're sharing with your friends, your coworkers, your family, or anyone else you think might be really needing to hear this content on how to heal and overcome from obstacles and tragedies and traumas. That's why we're here, so people can know that they're not alone, get some real good tips on how to better their life and to heal and to really be triumphant in their life and have a life that they can be excited about again. So thanks for being here.